dear students, welcome back to my YouTube channel Physiology Learning. So we are continuing with our ECG series, and today in this video we are going to understand the ECG paper setting. Like the ECG paper which is going, what is the paper setting, like how much is the duration or the speed of the paper and how much is the amplitude represented. By understanding this paper setting, we will be able to easily understand what is the normal value of each of the waves and segments and intervals as well as the amplitude of them. So this will easily help us to identify if there is any prolongation or if there is a malformations of the wave. So let's try to understand this ECG paper. And all of you know that ECG paper is a graph. So it is a graphical representation of the electrical activity of the heart. This everybody is clear. Then in every graph there will be an x-axis and there will be an y-axis. In the graph of ECG also we have an x-axis and y-axis, and the x-axis represents the time duration. The x-axis is nothing but the time and the y-axis is representing the amplitude. The amplitude is represented in the y-axis in millivolt. So it is represented in second or milliseconds. So that is the time duration on x-axis and amplitude on y-axis. And once you look deep inside the paper, usually there are some bigger boxes which is again consist of 5 smaller boxes. So inside the big box there are usually 5 smaller boxes. So the smallest division box, like small 5 boxes, will make one big boxes. So this is the smallest box. So we have to understand what is its duration, the normal duration of this box, as well as the amplitude of this particular box. Why is it important? Because if a wave is occupying a particular 2 to 3 box, if I know what is the duration and amplitude of one box, I can easily calculate the normal duration of that wave as well as the amplitude of the particular wave. So let's try to understand what are the standard settings in an ECG for this x-axis and y-axis. In the x-axis I told you duration. So the speed of the ECG paper, the normal setting that we have is it is 25 millimeter per second. When you convert into this 1 millimeter, it is nothing but it is 0.04. So x-axis, the box is 0.04 seconds. So the box is 0.04 seconds. And coming to the amplitude, the standard setting that we do is 10 mm is equal to 1 millivolt. And I told you the smallest box is 1 mm. So 1 mm is equal to 0.1 millivolt. So this smallest box on the y-axis side, it is nothing but it is 0.1 millivolt. So why are we having this standard setting? Because all the normal calculations and values which we are going to read in a normal ECG is standardized for this measurement. Can we change this setting according to our wish? We can change it according to our wish. But whenever we are changing it, we should always make sure that whatever implications or formulas we are applying, that should be changed according to the speed and the amplitude that we have set. So until unless you say it, as doctors we say it, nobody should change this setting without asking the permission. Why? Because it's all the standard recording of values and every calculation that we are going to do in an ECG is based on the standard setting. So until unless you request it, if some technician or anybody who is taking the ECG, they have changed it, all your interpretation will go haywire and it will be wrong. So again, let's take with this an example. As you can see here, this is the bigger box which I was saying. This is the bigger box, and inside that we have several small boxes. And as you can see here, the time is depicted in seconds along the x-axis, and millivolts is the amplitude depicted. And usually this 10 mm means like 2 complete boxes together will make 1 millivolt. So this is the standard recording. So 2 boxes amplitude, if any wave is present, that will make around 1 millivolt. So this 10 mm means 5 mm plus 5 mm will give that 1 millivolt. Now coming to the individual waves. So this individual waves, if it is spanning across a particular number of boxes, then it will be easier for us to calculate the duration of the wave as well as the amplitude. So that is the advantage of knowing this setting, that is the time and the millivolt. Sometimes we might have to change it. I will tell you the conditions of that. So whenever you pick an ECG, there are few things you have to look upon. Then finally you have to look upon the calibration also. And the calibration is generally given at the bottom. So this is an ECG. It is generally given at the bottom. And if you play a close look, the first 2 parameters which are mentioned here, that is 25 millimeter per second, and also 10 mm is 1 millivolt. So as you can see here, I'll zoom it for you guys. So this is the calibration setting. So we should always check this first and then only we can interpret. Now we will try to understand, like sometimes we might be needing a modified settings. So when we'll be needing that, so sometimes we might need to speed up the paper. Suppose for example, we have to take it at 50 millimeter per second. In which type of condition we want to do it? Suppose if a person is having tachycardia, so all his waves are coming closer to each other. So what we do? We speed up the paper. If we speed up the paper, what is going to happen now? Now these waves are going to be spread across time so that we can easily analyze them. So in a person who is having tachycardia, arrhythmias or atrial flutter or fibrillation, in them we will use this higher setting. So this is for people who have tachycardias. Because in tachycardia, the waves are very close to each other, it becomes very difficult for analysis, so that we can do it. And vice versa, we can reduce the paper speed like 12.5 millimeter per second, or less than that also we can keep it in patients who have bradycardia. But this paper setting should be instructed by the person or the doctor who is going to record and read the ECG. Because if the technician or somebody who is taking the ECG changes it according to their wish, what will happen? All the prediction that is done by the doctor will be wrong, because all the data that we are going to read in the further ECGs, we consider that this is the normal speed which is going on. Sometimes if this is missing, then it becomes a huge mess if the speed has been changed mistakenly by somebody. So always we will check for this, whether what is the speed, and if we have asked them to increase the speed, our calculations also has to be considered according to the speed change. Now coming to the amplitude change, when we will change the amplitude. So we can change the amplitude under two conditions. For example, we can increase the amplitude. For example, what we can do is, we can say that 20 mm, it is 20 mm per millivolt. Suppose this 20 mm per millivolt, we can do it. In which type of person we will do it? Whenever a person's recording, his amplitude is coming very low, he is having a low amplitude ECG. In those persons, if we do this setting, what will happen? The same 1 millivolt, now it is going to produce a increased height of the wave for us to analyze. In a similar way, whenever there is a decrease in amplitude, when we can decrease the amplitude? Decrease in amplitude can be considered if the wave is very tall already, and some of the leads of the ECG, they are merging with the leads which are on top. Suppose you have taken the lead 1, lead 2 and lead 3 in this fashion, one below the other, and these waves are touching each other because of the amplitude is so high, be it a hypertrophy or something. In those patients, what we can do is, we can keep 5 mm per millivolt. So these are some of the conditions where we can change the speed as well as the amplitude. But generally 90 to 95% of the time we don't need this settings. We will be recording the ECG under the setting of 25 millimeter per second and 10 mm per millivolt. This is the standard setting, we keep it. So the smallest box, if you remember this, it is good enough. The smallest box on the x-axis, it is 0.04 seconds. And on the y-axis it is 0.1 millivolt. What is the advantage of knowing this is, if I know a particular wave is covering one box, then its duration is 0.04 seconds. If it is covering two boxes, then its duration is 0.08 seconds. Like that, I can easily multiply and understand its normal duration. And most of the recordings, the wave amplitude and duration will be different in different leads of the ECG, because they are looking the heart from a different angle that we have already seen. But again, most of the parameters we will assess in which lead? We will be assessing in the lead 2. So this values which I am giving here, that is also based on the lead 2 recording. Because lead 2 is a strip which is considered a standard strip. We will do maximum analysis in that, and then we will move on to the next strips. So coming to the various waves, segments and intervals. Here I have given a simple thing to understand: number of squares. So if it is occupying a particular number of squares, then easily I can identify the duration. So duration and amplitude is for these waves like P wave, QRS complex and T wave. Then we will talk about the segments. Segments means these are isoelectric lines. So segments are nothing but isoelectric lines. Whereas interval means interval will have a wave plus segments. It can be multiple waves also. So basically they will include both waves as well as segments. Now coming to the P wave. With this help of this squares you can easily calculate it. P wave is generally less than 3 squares. The duration of P wave is generally less than 3 squares. So what is the duration? 3 into 0.04, that is 0.12 seconds. So the normal duration of P wave is generally less than 0.12 seconds. Then QRS complex is also same 3 squares. So again it is 0.12 seconds. Is there any 3 squares in this box? We can see ST segment. So ST segment is also again 0.12 seconds. Now coming to the T wave is usually spread across time. So the T wave is 0.16 seconds, less than that. PR segment is very short. So it is 0.08 seconds, occupying 2 squares. Now coming to the interval. So PR interval means it is P wave plus PR segment. So it is nothing but P wave plus PR segment. So it is generally less than 5 squares. So the maximum value it can be is 0.20 seconds. If it goes beyond this 0.20 seconds, then we can call it as PR interval prolongation, and the PR interval prolongation is an indicator of first degree heart block. So once you calculate the PR interval and you can spot that it is going for 6 boxes or 7 boxes, it is occupying multiple squares, then we can easily understand that its duration is increased and there is a prolongation. And QT interval, the normal duration is around 0.0444 seconds. I am writing the upper limit, it should be less than this. Now coming to the RR interval, generally the RR interval can range between 60 to 100 heartbeats. So it is usually 25 squares whenever the heart rate is 60, or it can occupy just 15 square whenever the heart rate is 100. So all this entire range is considered as normal. And RR interval means we are starting from one point in a wave and going to the next wave at the same point. So this will help us to understand that it is a heart cycle, or we can say it is one cardiac cycle, or we can say that it is one heartbeat. So all this are same, one heartbeat. So basically this RR interval is going to give us an estimate of calculating the heart rate also, which we'll try to understand in the coming videos. Now coming to the significance. So what is P wave? P wave is nothing but the atrial depolarization. And the wave's amplitude also I have mentioned here. The P wave is generally 0.25 millivolt. They say that it usually does not cross 2.5 boxes, because one box is 0.1 millivolt, 2.5 is 0.25 millivolt. And the QRS complex can go up to 3 millivolt. Generally it is around 2 millivolt, but it can go up to 3 millivolt. Then the T wave is usually around 1 millivolt. Now coming back to the significance, P wave is nothing but atrial depolarization, QRS is nothing but ventricular depolarization, then T wave is ventricular repolarization. Then the PR segment indicates the AV nodal delay. This we have already discussed, AV nodal delay. Then the ST segment indicates when ventricle is completely depolarized. This we have discussed in detail in the PQRST wave generation. You can go back and see the video to understand it better. Then PR interval will include a P wave plus PR segment. Whereas QT interval, it encompasses QRS complex plus ST segment plus T wave. All it encompasses. Then RR interval is nothing but one heartbeat. So with the help of this table, you can easily remember the number of squares and understand that the normal duration. So suppose if you just remember the number of squares, you can extrapolate it to the number or duration which the particular wave or the segment or the interval is happening. So this is all about the ECG paper setting. I hope it's clear. Thank you for watching the video. If you have any doubts, kindly drop it in the comment section. I'll be happy to make a video on it. Thank you so much. We'll see you in the next video.